Hi, I'm Dr. Julie. I'm the cardiologist here. It's nice to meet you. I see here that you're coming in because you have been having quite a few episodes where you're having chest pain, shortness of breath, and a little bit of sweating and kind of a feeling of something bad is going to happen. And how long have those been going on? Oh man, okay. How long do they usually last? Okay, 10 to 15 minutes? Okay. Okay, and is there anything you do to help make them go away, or any medications that you might take that help with that? Okay, all right. So you've never had these before at any other point in your life? Okay, all right. Well, I did order a blood test just to check two different levels. I checked your troponin. That is a protein released after cardiac muscle is injured and starts to break down. So we expect to find none in the average person's system. So I'm checking yours to see if any shows up in your system, which would indicate to us that you did have a heart attack. And then I ordered a CKMB, which is actually an enzyme that's released whenever cardiac muscle is damaged. It's very specific. It's a very accurate test. So I'll get those results back shortly. Okay, and that'll tell me if you've got any heart damage. Okay. All right. So, do you exercise frequently? Okay. What about any heart defects at birth? Any heart murmurs or anything? No? Okay. Well, I have this diagram I want to show you. I wanted to kind of go over the basics here. So this big blue one and this big one, those are your superior and inferior vena cava. So they're bringing blood back to the body that's been given out to the cell, so it lacks oxygen now. So they go directly into the right atrium, which is right here. And then the ventricles contract, and this valve opens up, allowing blood to leave the right atrium and go to the right ventricle. And then once that happens, they contract again, and blood is pushed through this big blue one, and it goes into the lungs to some oxygen. And then when it comes back through these. These are actually pulmonary veins. In the heart, the veins and arteries are reversed. So these are carrying oxygenated blood. And they're going to come into the left atrium, and then the ventricles will contract again, and that blood will come into the left atrium. And then another traction is going to send it up through here, which goes behind this, and then it goes through the aorta. And this is one of the most massive blood vessels, and it sends blood everywhere around your body. So based on your symptoms, you could have a block in one of those valves, or some of those arteries could be narrowing, and that's making it tough for the blood to get into the heart and out. And then you exercise, that puts even more strain on the heart to get out more blood, because blood has oxygen in it. Yeah. So I did get the 12-lead EKG back that they did on you. And the good news is, yeah, they are very difficult to read. Even people who've been trained to read them take a little bit of time to read them. But don't be freaked out. It just has a lot of information on it because it is a 12-lead EKG. And the 12 leads give me more information about your heart because they're in different locations and they're giving me information about what each part of the heart is. Whereas a 6-lead isn't giving me the whole picture. So this is your MRI, or well, your EKG. And this is the one we're going to look at here. This one here is the second heart lead. And I'm looking at these. And the first thing I notice is that the rhythm is very regular. And you've got a QRS complex. You've got a T wave and a P wave. Now, the QRXs are fairly close together because your heart rate is high, but it's not high enough to be really concerned about. What I was seeing there is just a sinus rhythm, and yours is just a little bit different because your heart's beating so fast that's making it sinus tachycardia. But other than that, your heart looks good, your rhythms look good. I am going to listen to your heart and just see if I hear anything unusual. Okay, so just breathe naturally. Okay, so again, your heart rate's just a little high, but that's not uncommon by coming to the doctor, especially given your recent symptoms. So I'm going to listen to your lungs. Just one. And then breathe out here, and here, and here. And then I'm going to listen down here on the sides. And then the other side. Okay. And then around the back. And around the other side of the back. Okay. They sound really clear, which is good. That's what I wanted to hear. If you were having any kind of a right-sided heart block, then your heart would be having to work a lot harder, and you would have fluid backing up into your lungs. But your lungs are perfectly clear, so that's good. Definitely not a right-sided heart block. And your heart sounds good. It's beating okay. It sounds like it's really strong. I'm not too concerned about a heart attack or any sort of heart problems. So what else? Do you have any medical conditions you can think of that may be causing these episodes? And what medications do you take at home? Okay. All right. And what types of prescriptions are you currently on? Okay. All right. And you take those regularly 3 times a day? Okay. All right. So let me get some gloves here. Okay. Just going to check your pulses here in your arms, okay? Okay, they're both equal and very strong. Can you grab my finger as hard as you can? Okay, good. You're really strong. Okay. Let me just look at your chest. Yeah. Okay. All right. And how are your kidneys? Are you having any kidney problems at all? Okay. Okay, excellent. All right. Have you ever had a treatment for anxiety, or have you ever been diagnosed with anxiety? Okay. Yeah. You don't have to be born with it. It can come on at any point in life. Anything can trigger it. We actually don't know what causes some people to have anxiety and others to not. But an anxiety attack feels a lot like a heart attack. They usually come on suddenly, and it is a tightness in the chest, a shortness of breath, feeling like you're just not getting enough air. It can make you feel like you're going to pass out. It can cause just really severe chest pain. And it can come on sporadically. It's not something that you can predict. It's not something you can really stop once it starts happening. But the good news is they do only last around 10, sometimes 15 minutes. Can you think of any stressors maybe in her life in the last year? She did. Okay. How old was she when she died? Yeah, that's really sad. How have you been handling that loss? And when was the first attack that you remember, the first episode of this heart issue? Right after the funeral? Okay. Well, all of your tests are showing me that you didn't have a heart attack, and that you don't have any heart damage. Your heart looked good. The EKG is good. Troponins negative. CKMB is negative. But I believe you just may be suffering from anxiety. And anxiety attacks can mimic a heart attack. And people do pass out from anxiety attacks. And it could be related to the sudden loss that you endured this past year. Yeah. So you should probably discuss that with your regular doctor about getting something for anxiety. I don't like to prescribe anxiety meds without knowing your full medical history, and your regular doctor has a lot more experience with you than I do. And he would know if that's a good choice for you or if it wouldn't work for you. So you should give him a call when you get home and schedule an appointment to see him right away. Yep, you do not have any heart problems. Nope, I would hear them. You don't have any fluid in your lungs. They were totally clean. Your labs came back good. There is practically no chance that you've had a heart attack. And I'm not even seeing that you're at risk for a heart attack based on what I saw. Okay, so give your regular doctor a call. Maybe look up some meditation classes or Tai Chi or something to just get that stress level down. Okay? All right, well, if you'll just go out that door there and give this paperwork to the secretary, she'll get you set up and get you set up with an appointment with your regular doctor, okay? All right, thanks for coming in.